I think one thing that led to the opioid crisis is lack of treatments, lack of options.
We're focusing on the wrong thing.
So doctors need to be able to practice medicine.
There's Norco, Vicodin, heroin.
The only thing that I would want was for all that pain to stop.
Patients would rather die than go through that again.
Methadone, Percocet.
I turned into a really ugly person.
Morphine, fentanyl.
I mean, they were taking 10, 15, 20 different prescription drugs a day.
Why all of the addiction? And what are we going to do about it?
There is overwhelming evidence. There is irrefutable evidence that cannabis is safe and effective. Cannabis is the gateway to getting out of opioid abuse. This is not my opinion. This is evidence that cannabis is an effective and safe substitute for pain-relieving drugs like prescription opioid analgesics. My name is Dr. Adie Poe. I am a neuroscientist who has studied the interaction between cannabis and opioids for the last 13 years or so. The most exciting and promising value in medicinal cannabis is the sheer volume of people's lives who will be improved. So we're not just talking about people who will stay alive because they didn't overdose on opioids. We're also talking about all those people who are suffering and there is no alternative and no other drugs have worked.
It is so hard to have to tell a family member, hey, your child died or your family member died from opioids, and then go to the next patient complaining of pain and prescribe them the same thing that just killed this other person. I might as well be like, here's a needle, here's a syringe. You might as well just start heroin because this is where it's gonna end up. I've been an ER physician for 6 years, and I've been involved with medical marijuana for greater than a year. I've seen people die from heroin. I've seen kids die from taking opioids. I've seen people die from benzo overdose. I have not, till this day, seen somebody die from marijuana.
I'm Mark Wallace. I'm an anesthesiologist, boarded in anesthesiology and pain medicine. I'm chair of the Division of Pain Medicine here at UC San Diego. A lot of the heroin users got their start with prescription opioids. That led the CDC to start taking a look at this, the Center for Disease Control, and saying, we have a problem.
In 2016, the Centers for Disease Control came out with a set of guidelines in order to curb this crisis. One of those was that we need to switch to non-opioid drugs for most cases of chronic pain. The National Academies looked at more than 10,000 studies in humans, only published since 1999, and they definitively concluded that not specific cannabinoids, not isolated cannabinoids, cannabis is indeed safe and effective for the treatment of chronic pain. So the CDC was asking for non-opioid alternatives, and the National Academies has given us an answer, and that's cannabis. The roots of the opioid epidemic are really in the early 90s. The American Pain Society came out with some publications in support from consumer advocate groups and patient advocate groups. They all came together and said, hey, we have a huge crisis of untreated pain in this country. At the same time, the emergence of oxycodone happened. So all of a sudden, you have this untreated pain epidemic combined with this brand new, what was thought of as a miracle drug. The evidence that we have now, obviously, is that there is no difference between oxycodone or any of these other prescription drugs and heroin.
Currently, in the United States, over 91 people a day dying from opioids. It's a terrible killer. We lose over 50 veterans a day now to prescription drug overdose and suicide.
It's not that they want to become addicted, but they either start depending on it or it's difficult for them to learn how to deal with pain.
There's an overlap between addiction and pain, which makes it very, very difficult. I think the answer is probably just to try to prevent them from going on the opioid in the first place.
Cannabis is safe and effective for the treatment of chronic pain, which opioids are not. Opioids are really great at treating severe pain, but over the long term, their utility is diminished because of the severe side effects that accompany them. In order to get pain relief, you have to suffer through those side effects. And one of the reasons that cannabis is an effective alternative to opioids is because it does not produce those side effects. We discovered that the active molecule in the cannabis plant was delta-9 THC. That was in the 60s, but it wasn't until the early 90s that we really identified what it was inside of our own bodies that was activating the same receptors that THC was.
We have cannabinoid receptors all over our body. They're located on inflammatory cells, white blood cells, lymphocytes. They're located all throughout the nervous system, both the peripheral nerves, the spinal cord, the brain. They have anti-inflammatory effects. They have various properties that have health benefits. And then the cannabinoid 1 receptors, when you stimulate them, you actually reduce pain transmission into the nervous system.
We have thousands of veterans who have used cannabis to get completely off of opiates. We have tens of thousands more who've used it to dramatically decrease the amount of opiates that they take. Cannabis saved my life, and it's saved the lives of thousands of other people as well.
When patients are given access to cannabis, they automatically reduce how much opioids they consume. And if people are consuming fewer opioids, then we have fewer opioid overdoses. And this is evidenced in the literature. At what point from injury to opioid overdose death is cannabis intervening to prevent opioid overdose? So there are lots of possibilities. It could be that early on, they start using cannabis instead of opioids. So you have the prevention of opioid use entirely, or you have the prevention of opioid escalation. So instead of taking more and more opioids because they've developed a physical dependence and tolerance, they switch to cannabis.
The nature of opioids is that you need to take more and more to experience the high that you had in the past. People don't really realize how addictive it is. So just the pain of coming off opioids sometimes maintains people on the opioids because they don't want to go through this experience.
I've had many patients in my practice that have been able to wean themselves off of narcotics and use marijuana instead.
Now, it's also possible that once people are physically dependent upon opioids, they turn to cannabis for help. Cannabis can alleviate the withdrawal symptoms, this very bottom of the barrel human suffering. Opioid withdrawal, I can assure you, is probably the 7th level of hell.
Heroin detox is the worst physical feeling I've ever felt. The worst flu you've ever had, mixed with a stomach virus, fluids just coming out of you everywhere. There's a whole mental part to it too, where you lose interest in everything. You want to jump out of your own skin.
I don't even know if there's words to describe the degree of pain and suffering. You know, it's like breaking 1,000 bones all at once while your skin has needles being shoved into it, while you're burning up from the inside out but freezing at the same time, and projectile vomiting and probably experiencing diarrhea all at once.
Now, I took 180 milligrams of OxyContin a day and 40 milligrams of Ambien just to be able to sleep 1 to 2 hours at night. The only thing that separated me from poor guy or gal that was shooting heroin under the bridge is the fact that I was able to obtain my opiates legally.
The brain does not care whether you're getting this drug from a prescription or whether you're getting this drug from a street corner.
When I was 16, I was introduced to OxyContin, and my love affair with opiates really took off. Eventually, my sister and I were up to smoking 10, 15 pills a day. I mean, they did nothing for us because we had built such a high tolerance. Eventually, we moved to heroin.
As a social worker, one of our foundational principles is to reduce harm and to let people grow and determine their own life. Cannabis allows us to do that. It's important to know that people can replace the use of something that's hurting them or killing them with medicinally dispensed cannabis. It does make the detox infinitely more tolerable.
The first few days went by much easier than any other detox program I've ever been through. Cannabis really helps in those early days. Something a lot of people in the recovery community don't understand. Maybe there's old stigmas, But cannabis really does help keep me off chemicals that would kill me. Any movement in that direction, you know, away from killing yourself, is progress, and that's harm reduction to me.
It is very tempting to tell patients, hey, narcotics are not the answer. I think you should try medical marijuana. I feel like that would be more beneficial for you. But the fact that it is federally illegal, providers are not doing it.
I was first introduced to opioids when I was about 18. I was a senior in high school, and I kept taking them. I didn't really think there would be any consequences. I started smoking heroin almost every day, or as often as I could get it. I was using heroin for probably close to 5 years. 5 years straight, yeah. Every day, became about getting high, not wanting to feel sick. The only thing, that I would want was for all that pain to stop. And that meant finding heroin, finding opiates immediately.
I absolutely believe that if anyone's earned the right to decide what to put into their bodies to treat their injuries, their pain, their mental health, who would that be other than veterans? We have all these brave men and women, all these American heroes coming home after surviving some horrendous combat situations only to be killed by the people that are supposed to be taking care of them.
So this is just a huge shame. If almost every single veteran could probably have their quality of life enhanced if they were allowed to bring cannabis into their regimen. A vet can't even talk to their VA doctor about cannabis medicine because the VA doctor is a federal employee and cannabis is a federally controlled substance. Everyone wants more information about cannabis as a therapeutic. In the most recent request for the DEA to reschedule cannabis, the DEA did their job and turned to the FDA and said, can you tell us, is this safe and effective? The FDA, through their very vigorous and rigorous process, concluded that no, there was not sufficient evidence to downgrade cannabis from a Schedule I. This is the nature of the catch-22 in cannabis medical research. You can't get data because it's a Schedule I, and it's a Schedule I because there's not enough data.
The definition of Schedule I is there's no medicinal use. High abuse potential, no medicinal use. Well, we know that the abuse potential is low, and we know that there's a lot of medicinal benefits from it.
I am a pharmacologist, and when I look at the cannabis plant, I see incredibly complex pharmacology. I see hundreds of biologically active molecules, which have a variety of effects on the brain and the body. In the FDA approval process, typically their formula is that the drug is one molecule and that there is one indication, one illness. If you think about the clinical use of cannabis medicine, it is neither of those things. It is not one molecule. It is not a standard preparation. It's not just being used for pain. It's being used for anxiety, for PTSD, for insomnia, for Crohn's, for many, many things. So on both sides of the equation, cannabis does not fit into the regulatory framework which the FDA has set up in order to bring an experimental drug, a preclinical drug, into the marketplace.
It's all about education. We just have to put pressure on the people who are in control and don't give up, and just know that eventually the word will get through and the change will occur.
I started medical marijuana practice because of the opioid epidemic. I feel like medical marijuana is the answer. I would much rather have a patient rely on marijuana than have to rely on a benzo or rely on a narcotic. Because people are not dying from overdoses of marijuana. There hasn't been a case.
If you look at states that have passed medicinal cannabis laws, on average, there is a 25% drop in fatal opioid overdoses. Now that effect gets larger the longer that law has been instituted. So for instance, in the state of California, which has had a medicinal law since 1996, there's actually a 33% reduction in their opioid overdose rate.
I'm using cannabis to get my patients off of opioids. It's amazing how many people will wean off slowly, and now they're in a lot of pain. And then I'll introduce the cannabis and they feel better. And they say the difference is they feel that I've given their life back because they felt a slave to the opioid, and that they're looking at their clock when I'm going to get my next opioid, when is my next dose. When you take them off the opioid and put them on the cannabis, they stop looking at the clock, and they don't feel a slave to it.
We're focusing on the wrong thing. Medical marijuana should not be classified as the alternative. It should be the first line of treatment.
Cannabis probably has the greatest potential to have a major impact on public health, specifically through its ability to diminish our reliance on opioids. This is cannabis's greatest opportunity to do the most good in the world right now.